Hello, everyone. We're going to let people join from the waiting room and we'll get started in just a minute or two. We're thrilled to have you join us today.
Maybe those of you that are logged in could put in the chat where you're joining us from. That'd be great. We always love to see where people are coming from around the country. Hello, Dr. Lindell.
Hello, how are you?
Good.
I'm trying to look like I'm not in the dark, but there's something weird. All today, all my meetings, I've looked like I'm like somewhere else.
It looks dark.
And it's sunny as could be here and 70 some degrees.
Oh,
Right. Well,
Queen's University,
yeah. Should we go ahead and get started if you want
New
to share the
Jersey.
slides, Andra?
Oh, sorry, I'm busy over here looking at where everybody's coming from.
No worries.
Hi, everyone. My name is Andra Davis, and I am part of this team that helps support schools of nursing in integrating palliative care education into their nursing programs. So hopefully now you can see the slides.
Mhm.
Okay.
All right. Well, so as the other counterpart to this team, I'm Dr. Megan Lippy, another um, part of the ELNEC team, and I'm an associate professor at UT Health in San Antonio. And we are thrilled to have you join us for what is the last of our series of explorations of the different modules within our ELNEC undergraduate and ELNEC graduate curricula. So today we're going to be focusing on Module 6, which focuses on APN leadership in serious illness. This has a very different lens than we see in our undergraduate program because we recognize we want our graduates to be entering into spaces where they're assuming leadership roles in various ways. So wanted to, this module really helps for them to think about how can they step into leadership roles within the context of palliative care and serious illness. And we're thrilled to be joined today by Dr. Dorothy Wholihan, who is another one of our ELNEC faculty, but she's an APRN, she is a palliative care expert, she is so many things. Including an incredible leader in palliative care. So we're thrilled to have her join us. She is the program director of the Advanced Practice Palliative Care Specialty Sequence at Rory Myers College of Nursing at NYU, amongst many other things. And so we will, if y'all haven't joined us before, we start off with a little bit of an overview, some introduction content. Andra will then give some exploration of the module itself, and then we'll open the floor for Dr. Wholihan to talk about elements related to leadership. So as we go through this, if you have specific questions burning questions about teaching leadership in serious illness with your graduate students, please drop it in the chat. But we will have some opportunity for further dialogue partway through this session. So with that, next slide. We always like to ground these sessions first in recognizing who supports this. And so we do like to give a shout out to ELNEC as well as the Cambia Health Foundation, who helps make these webinars possible. And then thinking about what's the context. And just know these slides do get shared after the webinar, and our session is going to be recorded. So you'll have access to these. But we like to share this really sort of one of the seminal documents that established that there's an important role for education in and preparing nurses to provide palliative care, but that nurses really have a key role in leading and transforming palliative care in many settings for any patient living with serious illness. And if you can go next slide.
Oh, sorry.
That's okay. And so what their first recommendation of this document says is that faculty schools should adopt ELNEC curricula as a standard for primary palliative care education. So again, that generalist education for students. Now, at the time of that publication, ELNEC graduate didn't exist. This is a relatively new curriculum, but we would say that would also have been listed as well if ELNEC graduate existed at that time. Next slide. Oh, one too many. Go back. Perfect, thank you. So if you're not familiar with ELNEC, the ELNEC project, it started in 2000 with the creation of ELNEC core curriculum. And the first course was offered in 2001. Since that time, there have been many different ELNEC curricula that have been developed, and Dr. Davis and I specifically help with the undergraduate and graduate curricula and support schools of nursing in advancing their palliative care. So today we're going to be focusing on the ELNEC graduate module 6. And I'm sure many of y'all have seen or heard of the essentials, but at the content, the topics, the concepts we're going to be addressing today are really targeting that level 2 student, that advanced level student. This is where the graduate curricula is intended for that level of student, I should say. Next slide. And of course, we were thrilled when we saw the essentials and the naming of the 4 spheres, one of which is hospice and palliative care, which really has established that palliative care is content that is not nice to know, it's a need to know. And so we as faculty have a responsibility to really prepare students to be able to be competent in providing palliative care to their patients. Next slide. We want to share with you a helpful resource. Dr. Davis will drop this in the chat as one of the resources. But we have competence statements that were originally the graduate statements, which are called GCARES. So these are competencies and recommendations for educating nursing students, but we call them CARES, and the graduate version is GCARES. These were originally published in 2019 with a combination of 13 different statements. After the release of the new essentials, a team of us updated those to align with the essentials. So we no longer differentiate between all master's or DNP students versus direct care. All of these 12 statements really speak to the role of any advanced level student in palliative care. And so you'll see they're sort of global statements because they're really intended to guide the competence of the learner for whichever place or track they're preparing for future practice. Next slide. And when we do these webinars, we always like to highlight, well, which of the CARES or GCARES statements align with this module? Well, as you can see, pretty much everyone aligns with this APN leadership module because, as I mentioned, they're global statements, really speaking to the role of an advanced level nurse in palliative care. So you'll see many of the statements throughout this are at that targeting that leadership role in the articulating with teams and families, in the communication skills, advocating, consulting, collaborating, a lot of leadership skills though. And many of this is sort of driving change within their current practice context, whatever that might be. Next slide. So as an example, we have, I should say, before I go to the example, part of our work when we updated GCARES was to map all of those statements to the essentials. So we have a document on our ELNEC website in the faculty corner that aligns all of our GCARES statements with the essentials domains, competencies, concepts, and subcompetencies. And as you can see here as an example, our 4th statement, which is demonstrating leadership guided by principles of ethics, social justice, equity, and moral courage in the advancement of quality palliative care, we've aligned with pretty much every domain of the essentials. There's different types of alignment with the subcompetencies that you'll see there. Next slide. I think, there we go. As another one, communication skills, you'll see that these align with other domains as well. So a lot of alignment, but this is resources we encourage you to explore further. Next slide. And this was so today is our culmination of our webinar series where we focus on APN leadership in serious illness. But all of these prior webinars were recorded and they are free and available on the ELNEC faculty corner, which will show you how to get to that later on. But thank you for those of you who have joined us for prior sessions, and for those of you who are joining us today, please know you didn't miss anything because you can go back and review all of the other webinars that we've provided related to our ELNEC graduate curricula.
How many are new today? Could you pop that in the chat too? That would be really useful to hear. Okay, carry on.
As of our last sort of data check, we have almost 1,200 schools who are utilizing the ELNEC undergraduate, new graduate curricula in some sort of capacity. And we are so close to the 400 mark for our ELNEC graduate. We've seen immense growth in the utilization of these curricula following the release of the new essentials. And so whether you're using it or you're considering using it, we hope these webinars are helpful to help you explore how you might begin to integrate this curricula into your content, or ways you might enhance the utilization of the modules in your curricula. So with that, I'm going to turn it over to Dr. Davis, who's going to give us a little taste of the module.
Okay, so while we switch gears and do a little tour, the point of the tour of the module is not to engage fully in the content that's there, but really just to share with you, what does this student-facing module look like? And again, another request for in the chat would be great to hear how many of you are currently using this curriculum in your programs. While I switch over here, and you can kind of watch that. All right, so here's kind of this module, unlike some of the other ones that have it does have some sort of stop and think or check elements, and one sort of testimonial or recording. The other ones have more of those intertwined, I would say, than this leadership module does. And Dr. Wholihan, you can jump in anytime if you want to share ways that different parts of this may be useful. Otherwise, we'll just sort of save, after we do this drive-by with the module, save time for you to kind of just talk about, reflect on how faculty might use this in their teaching. So with all good educational modules, we start with objectives. And we won't obviously go through and read all of those, but the one thing that I wanted to talk about here has to do with, so there's this section on the palliative care. Why is it not moving? Okay, here we go. The primary palliative care competencies. Dr. Lippi just mentioned that there are newer updated GCARES. I did put those in the chat. So what you will see that's different and will be updated when this set of modules gets updated is that the GCARES will look more like what you just saw and not like what's in this current module. So given that, I think, and so if you were to click on each one of these tabs, you would see kind of the association of the previous version of the GCARES, but I'm not going to do that for this drive-by. So I'm like, there we go. Okay. I'm having a little trouble navigating. This one is a little bit different than undergrad. So there's a section here that goes over sort of basic palliative care leadership across a variety of settings. But prior to that, you can see, if you can see the screen up here, the section 3 looks at essential basic leadership elements. I don't know why it's not letting me. Oh, there we go. Sorry, everyone. I'm having like technical issues today. So the other thing that I notice as you go through these is you kind of have to take a breath when the picture first comes up, because then some text follows it. But if you were to click through too fast, you might miss that. So that might be an important thing to tell folks. So there are 3 basic principles around essential to basic leadership. This may be mentoring, empowering others, and innovation. And then there, following that is an exercise on how you might use some of those things. One idea in a class setting is to maybe have a 2-minute writing session around what are elements of mentorship, empowerment, and innovation. turn to each other and kind of share what those things would be within the context of an advanced practice role. And those of you that are using this, it would be great afterwards if we could have a bit of a dialogue about things that you're doing as well to share. And then we see it drill down a little bit more in the context of people with serious illness, and a variety of slides here that go over clinical practice and pediatrics. I think there's one slide in here about peds, and you could, so here's kind of what happens here: area of development, areas to develop, and then they would click on all of these things and see an example in practice. So it's a way to sort of reimagine, if you will, where and when these things might be addressed in advanced practice roles. Administration, this one talks about administration, and we have research and quality improvement projects. And so, as you can see, it goes through all of these different areas, and then it culminates here in a case study. So this is another place where you might either do it in the classroom or have people kind of turn to each other and work through this together. And it's really aimed at identifying examples of leadership, attributes of the advanced practice nurse in leadership. And then they go through the whole case, and then they revisit the case. And then the very last section of this module is around resilience. There we go. And talks about concepts that we are all familiar with, including fetal care. There's a case study, again, in this section that gives some context and some opportunity to work through together. They do it here, but then you could unpack it in some other way in the classroom. I think one of the things that we try and reinforce is that for all of these modules, undergraduate, graduate, that it's one thing to have people go through this and do it, but it's another layer, an important layer, to unpack it and process some of it together in another way. And so that's an opportunity for all of us to imagine what that might look like. Compassion, fatigue, and workout, burnout, healthy work environment, self-care strategies, and fostering things that foster resilience. Maybe an overused word post-pandemic, yeah? Possibly. Self-care is essential part.
My name is Polly.
So I'll stop this for a minute. This is the one recording of those of you that know Polly Masnick, our beloved partner in the ELNEC team, where she speaks to the folks that are finishing up this module, recognizing that it's the end of this series of modules, and just really commends folks for taking the time to go through and commitment to primary palliative care education. So I won't play it, but you can see really short. So when there are videos embedded in these different modules, they're usually just a couple of minutes. And then concluding statements and summary and references. So again, this module will be updated in the next year with newer references. The one that I think might be most useful to all of you now currently is the one that we share, the CARES and GCARES document. So I'm going to stop sharing that. And that was a quick kind of drive-by of what it looks like for students. And let Dorothy take it away if you have any kind of big picture ideas in terms of leadership.
Hi, everybody. It's nice to see you. I'd love to see some faces. I know you're eating lunch, and that's fine. You can chew while you eat, but this part of the program, I think, would be much more beneficial for all of us if it could be a little bit interactive. So come on screen if you can, little black boxes, and let's have some conversation. This is what I do with the students. I say, put away that beer in the coffee cup and come on and talk to me. The age of Zoom. Welcome all. So let me just tell you a little bit about who I am. My name's Dorothy, and I live in New York City, where the weather is kind of crappy today. So it's good to be inside talking to some colleagues. I teach at the NYU, and I teach a very pretty robust palliative care NP specialty program that was actually the first in the country to be developed. So I teach nurses, a lot of nurse practitioners who want to be palliative care specialists first. And so we have people who add a specialty, which includes 4 courses actually, and 300 additional hours onto their primary population focused program. In addition to that, I'm very involved in trying to increase the primary palliative care skill set of our graduates, which is a lot of what we're looking at today, I would think, by teaching several electives, both undergraduate and graduate, a year in palliative care, and then also inserting myself in a pretty audacious way into any course who's looking for a guest speaker on any of these topics to try to get this stuff there. And almost everybody wants, no, hardly anyone says no to a guest speaker. So I spend a lot of time inserting myself into everywhere, even, from the pediatrics program, the midwifery program, wherever they'll listen to me. So I want to start just by talking about leadership in the context of palliative care and how I think there's a couple of main things to think about here. One is that palliative care and nursing leadership are meant to be together. Because I teach specialists, I frequently say I'm teaching leaders, but it's also hard to teach this concept, I think. If you're teaching in a graduate program and you're teaching basically new advanced practice clinicians, none of them leave, or as they're about to graduate, we're all in May season or approaching May, none of them seem to feel like they're ready to be leaders. Right? I think many of us are looking at students who are feeling more imposters, right? They're a little bit overwhelmed and they don't see themselves as leaders. And so in trying to inspire those kinds of thoughts in people is difficult. And we have a lot of information out there that is kind of theoretical. And so I think what's really important is to try to operationalize a lot of these concepts of leadership. I think they're well operationalized when you look at palliative care nurse practitioners in particular. And so I think that's what this module is trying to get at. It's giving us case examples. It's giving us pretty concrete kinds of things to talk about to try to make some of these concepts real to what the students are seeing and experience every day. So could I start by asking some of you how you are using this particular module, or if you are at all using this module and how you are, so maybe we can share a little bit from each other before I start giving some ideas that I do. Is anybody using this? Kathleen? Kathy, hi.
So Carrie leads this effort, Carrie Cormack, and all of our graduate students take this, no matter what their major. So our PhD students and our DMP students.
Great. And so they do this on their own?
Yes.
Right.
Okay. It's a scholarly activity.
Okay. Right. Great. Does anybody else have it as required parts of their coursework?
I was looking in the chat and that no one really replied to that. So maybe, here we go.
Audrey, can you come on and tell us what you're saying? Where are you, Audrey? Got a chat there.
Hey, everyone. Yeah, we're actually working with Carrie, and Megan will be meeting soon. So we're in the process of incorporating this across our programs. So very exciting.
Okay, so
your program is where?
So it's Frontier Nursing University.
Right,
So we have the spectrum of APRNs, and I work in hospice and palliative care. So it's my passion.
Great.
And so do you anticipate taking a module here, a module there, and putting it into different coursework? Or how do you see that?
So our, at this point, our different population specific programs will be doing it all a little bit differently. We have midwifery, we have FNP, we have psych mental health. So everyone's approaching it a little bit differently.
Okay, great. Oh, but they've all got it. Did you have to was that a hard to do mandate?
No, we have champions in each program. So yeah, it's wonderful.
It's great. It's great. You know, ever heard the expression, it's easier to move graves than change curriculum?
I'm the curriculum and course design coach, so I really feel that.
Yeah, yeah, that's excellent work. Sharon, why don't you come on instead? Can you share, Sharon, what you were saying?
Yes, last year, for the first time, we put the ELNEC graduate curriculum into our APN program, which is for family and adult gero. So we actually purchased it for them and integrated it into their last 2 semesters so that they could do it over the 2 semesters. And then faculty could follow up on some of the topics. And one of the faculty is has her certification as a palliative care nurse. And then in the last practicum that they take prior to graduation is a time that they can elect to do a specialty rolled. So that was 2 of our partner schools, the palliative care advanced practice nurses volunteered to be mentors and serve as their preceptors. So we had a few students that took them up on that and did their placement for that semester there, and then others could just elect to kind of follow them for anywhere from like 2 to 5 days, just to kind of get an insight into their role. And I think it was very well received by all the students.
Great, great, great. So it sounds like many of us are using these modules for folks for the students to do on their own, and then trying to figure out how the best way is to follow them up. So what I do in my elective course is these are mandated and they're fit in according to the topics that are going to be spoken about that week, and they're required to do before you arrive in the classroom. So we know at least everyone's arriving with this basic level that's provided in the curriculum. And I think that's one of the things that is really very helpful for us as providing foundational knowledge that then we can use as a jump off point. So if you think about that, and then you think about leadership, you know, where is the best way, or how is the best way, or how are any ways that we can kind of meld these ideas of palliative care and leadership? And I think there's a variety of different ways to do this, and I'd love to brainstorm a little bit about some of the ways that you can incorporate leadership content from a palliative care context, using this modules as your baseline foundation, and then jumping off and then really operationalizing it. So let's look for a basic example. So one of the things that students tell me about all the time when I ask them, what are the challenges of palliative care when you see it? And then that's it. You know, usually we're talking about, I don't know, primary care or even med surg or inpatient care. What do you see are some of the challenges? And almost without exception, people say palliative care gets entered into the picture too late, right? And we know that this is a problem within the entire country, and it has a variety of different reasons why. So then we think about that, and then I think about the leadership qualities of advocacy. How can we advocate for our patients to have access to these? How can we empower the nurses who are working with us, because we're leaders, to advocate for their patients to get this kind of care? And how can we translate that into something that can be demonstrable, something that's a competency that we can actually measure and see? So one of the assignments that I have people do is I make them submit videos of themselves defining what palliative care is. And they have to do a video which is less than 1 minute, the shorter the better in many instances, where they define palliative care to a medical colleague, a frail patient or family member, and a guy in a bar. so that we are able to, or a gal in the bar, or a gal in the cafe. It doesn't have to be a bar, obviously, but I'm aiming for that casual public education kind of thing. So can our students even clearly define what this is so that patients can understand what they're asking for and referral sources can understand what the benefits are? And boy, do they struggle with this assignment. And it is so simple and it is so basic to what people need to do to advocate for palliative care, is be able to tell people what is palliative care and how can it help and how is it not hospice? Because they also want to jump right in there and say, palliative care is not hospice, of course, right? They want to define something by what it is not. So it's actually a fascinating and pretty easy to do kind of assignment to put right in there. How are you able to communicate? It touches on the skills of communication, of interprofessionalism, of empowerment and advocacy. So it's a kind of example of how you can take those themes and operationalize them in a way that is something that is basic that they need to do. They need to know how to do. Can anybody think of any other ways that you can think about how to operationalize and measure the competencies involved with some of these leadership activities? So if we're thinking about these, if we think about these ideas of these leadership types of competencies of change agents and empowerments and interprofessional leadership and advocacy and looking at health equity and translating evidence to practice, how can we help our advanced practice students look at those kinds of things, even through the lens of palliative care? Ideas? Anybody doing anything interesting that they'd like to share?
Dorothy, one thing that I would like to mention is that, so in this module, as Andrew mentioned, there's a couple different knowledge checks where it's questions, and some of them at the beginning are more where they reflect on their own leadership currently, or where are they, how are they doing, what are their thoughts on certain prompts. And then later there's several different cases embedded into that module. So it's one thing, faculty might consider, especially if you're in online programs where maybe you're needing to operate more in like asynchronous virtual spaces, where maybe you could take those prompts and make them a discussion post, or make the case study an assignment where you actually ask them to respond, not with the answers that are given in the module or the ideas shared in the module, but their own thoughts about it, as a way to get them all kind of talking about the same topic with each other. But that's one thing we encourage faculty to consider is with these, where there's reflection points in the module, can you use that as a beginning point to getting students to reflect on the content and then maybe moving into some other application type activities?
Great.
I love any idea that helps people kind of do that metacognition of what do I think I know about something. And just building on your idea, I love that the video. So they would do a video on each of those scenarios to a colleague, to a patient, and to someone at the bar.
Public.
At the bar, you're going to shut down the conversation probably, but whatever. So
Yeah.
it would be really interesting to do it like at the very beginning, before, when you think about metacognition, like what do I think I know about this, and try to do it, and then have them at the end maybe do it again and see how they are better able to articulate it later.
I think in the same way, I do the same kind of, I used to teach basic health assessment to the graduate students. And I used to start out there with, okay, these were nurse practitioners. And I said, okay, so what is a nurse practitioner and how do you explain that to what a patient is? And without fail in the beginning, it was always, well, I'm kind of like a doctor, but, right? And so it became, you need to now define yourself without defining what you are not. And also not forgetting the fact that you are a nurse, which is a big issue, I think, in advanced practice education. I'm not sure, and I'd be interested to hear if others have the same situation, but I feel like many times we bring nurses in, some of them with little experience, some with them more, and then we teach them this new skill set, and much of the skill set they're learning is medical. How to diagnose or prescribe common medical illnesses and deal with symptoms management in palliative care. And they kind of have to learn their nursing perspective again before they leave. And so putting together that whole issue of defining yourself and what is it that makes you, and then defining, you could take it a step further with an assignment that says, how can you function as a leader in your new role? You know, and they're just so, I think, and they struggle with that. So one of the things that I think is really important is for them to take these concepts that we're teaching and then demonstrating in case studies, and then taking them to the clinical setting. So an assignment that I have to them do is to think about the role of the nurse practitioner within the system, because that's what we're talking about when we talk about leadership. And they have a discussion board assignment where they have to look at a nurse practitioner, and in this case, a palliative care nurse practitioner in the system in which they're working, and really analyze, what does this team look like? What is the role of the advanced practice nurse in this team? And who has the power in this team? And does this nurse practitioner have power? And is it traditional or is it not traditional power? And how are they looking at outcomes on this team? And what kind of professional development does this nurse practitioner participate in? And what kind of self-care does she do and or he? And then analyze that. And the last question is, would you like this job? Why or why not? So that you're, again, making them take the topics that we talk about. How do they translate evidence? How do they keep professional growth? How do they take care of themselves into a real life lens? Because there's so many people, I think, who enter master's programs because they do see role models that, you know, that I want to be like them. I want to do like what they do. And that's one of the reasons they come back to school. So I think it's important for them to be looking at how are you seeing these leadership qualities played out by people. You can't imagine yourself necessarily being a leader until you get your feet wet and you know what it's like to be a nurse practitioner. But then the next step is to develop those leadership roles and take on leadership roles. So what does it look like in people who are doing it? And so that, I think, is another great assignment, because it actually is, it's very hands-on, it's very operationalized. It's seeing the kinds of theories that we're talking about with leadership played out in real life.
Another thing that comes to mind, so this module specifically has quite a not super lengthy, but there's a good amount of content about fetal care. And, you know, this is, I think, another opportunity where at the registered nurse level, how you might address fetal care is, you know, or perceived care that is perceived to be futile, right? Or unnecessary or inducing suffering or those sorts of things. How they can step into a role and address it is very different at the RN level versus the APN level. And so even getting them to envision through different sort of strategies, you know, okay, maybe you addressed it as an RN if you saw a patient, you know, in this situation, but how might you step into that and use your APN skill set and knowledge to respond to perceptions of fetal care in this new role? Because that's a place where that advocacy comes in as well, but they have, you know, their scope is different now. And so how can they think about leveraging that new scope to enact change and advocate for their patient? Just something to think about along that same line.
Right. That's a great point, Megan. And it's a great point. And I love very much that this module includes so much information, because that is such a personal challenge for many, many nurses and a cause for moral distress among nurses. And so it speaks home. But it's interesting, and it's a great point to think about, is that when you are a staff nurse and you are distressed by that kind of care, what do? You go to somebody higher up. And now all of a sudden, you are the nurse practitioner. You are the person people are coming to help resolve some of these ethical issues or these care problems, issues with care. And so all of a sudden, you are the resource person. And when you tell a student that, they're like, oh my gosh, I'll never be able to do this, right? And it makes them anxious. But then you put them into a simulation where they have to have a family meeting and they have to run a family meeting and support each other. So I do a lot of simulation based on this background work. And I'm assuming that others do the same. Do you have any experiences with simulation like you'd like to share with some of us? Anybody?
So I can share that we have the equivalent of Vital Talk that's offered through the VA system. And they come and they work with all of our DMP students. And it's essentially, they can't call it Vital Talk because it's through the VA, but it's very similar to their course. And in that, I think it's 5 hours. And during that time, they do a lot of role playing.
Yeah, for those of you who might want to access additional Vital Talk material that was developed by Vital Talk, but isn't the same cost as Vital Talk, you should check out the VA Integrated Ethics website, which is the VA when they developed their recent. I'm a VA nurse from a long time ago, and I practice in the VA now. And the VA used all of your wonderful tax dollars to develop a very comprehensive life-sustaining treatment decision initiative, the LSTDI initiative, and they hired Vital Talk to come in and develop the communication materials to how to talk to people about goals of care. So everything produced by the government is free. So go onto the VA website and just Google up ethics and decision making and goals of care, and you'll see all sorts of great materials that have been brought on through that organization, through the Vital Talk group, for use. And that's free for everyone to use. So those are great resources for communication. Thanks for bringing that up, Kathy.
Yeah, that was a great thing to remind us about.
So I mean, there's so oops.
Go ahead, go ahead.
There are really so many resources out there that to build upon. My husband jokes that I spend 1/3 of my professional time looking at YouTube because I spend a lot of time looking for really effective videos to use in the classroom, because we all, our learners are different now, especially undergraduates, but graduates as well, and they want more visual kinds of things to relate to. So this is a great a way to think about accessing different kinds of information and bringing them in. Andrea, what were you going to say?
Oh, I was wondering if I get the feeling that there are a lot of folks maybe that have not been using these, and I just wonder if anybody has any questions about the modules in particular. The VA resources.
Oh, I can try to look it up and
Pop it in there. And to that end, there are other kind of resources. I know that the those of you that are, maybe not feeling so equipped to teach this and want more education yourselves, there are the summits that happen twice a year. ELNEC puts those on different parts of the country, and faculty that enroll get $100 off registration, and they're a great place to come together. Dorothy is a core member of that teaching team coming up, and Ryan knows all about registering if you're interested for the one coming up in April. I think I don't have the dates on the top of my head, but that's another sort of resource for you to build your skill set. And then there are other resources as kind of compendiums for each of the modules. And I think I'll put one of them in the chat here for you, and it's an additional resource to use in addition to this particular module and the different things that we've been talking about today as well.
I did just
Questions?
quickly looked it up. You can just Google or put in the chat ethics.va.gov. And you'll get the National Center for Ethics in Healthcare webpage, and you can go right down in, and it'll be a whole section on goals of care, conversations, skills training. So I'll try to see if I can put that whole thing
Looks
in.
like Audrey put something in too. I don't know if it's the same thing.
See if I can get this. I'm just see what that finds you. Anyway, how's that? So let's think about, those of you who work in DMP programs, right? And you're looking perhaps, and many of our programs are, all the way through for a DMP now. So let's think about, quality improvement projects and the leadership involved with quality improvement. I mean, that's a big piece, even if you are not got a DMP, if you're working in a systems oriented role, quality improvement is a big part of the leadership that you're involved with? How do we affect change? How do we make it better? And even we have a separate step out master's program. So I teach a lot of master's students as well as DMP students. And I have abbreviated QI lessons for all master's related students so that they know the process. Everyone thinks about QI and they think, how do I identify a problem and then fix it or address it? And everyone likes to come to the table saying, here's a problem and here's an idea to fix it. And no one wants to collect the data or do the investigation around it. And so that is a real interesting learning, just having someone come up with a plan for a quality issue is an abbreviated kind of assignment that leads to great discussion because many of the quality issues are shared and come
Yeah,
out when are in clinical settings. They come out and they're right there in their face.
It makes me think about another way that ties into what you're speaking about, actually what everybody's talking about, all these different ideas, is I have pulled up, and I'm just staring at the 12 competency, the GCARES, that each one of those is an activity, like to operationalize this concept, this sort of more abstract thing, is to say, all right, when you did the recording, it addresses number 1. You talk about a QI, that's maybe number 5, engaging in strategic partnerships, and what are some opportunities for improvement, and how each one of these things contributing to an environment that fosters well-being. When you think about fetal care and how can we support the bedside nurse and so forth, each one of these could be operationalized to help them put on that leadership hat in some way and imagine themselves in that role.
Absolutely. I think that the self-care piece of it is a really interesting one too, which is kind of also part of these GCARES competencies and comes up, of course, in the module. In that, during COVID, I was doing some work with ELNEC and I was writing a little like bloggy thing about nurses during COVID. And it was so interesting to me because I would talk, even now I talk to people about self-care and so often you just get eye rolling and saying self-care, come on,
Right.
So how do you make that meaningful for a person and operationalize it? How can you help pay students and to realize that a lot of times when they're now working as nurse practitioners, when they're leading teams, whether they're working, in an outpatient setting in a clinic or an office, and they have people working under them of all sorts of different disciplines or levels of care, or they're, intensivist, hospitalist, or NPs in the hospital, or they're running a hospice team. They have, the self-care of the entire system now becomes part of what is your issue when you're a leader. Right. So when you go into that nursing home and you're the nurse practitioner there and the staffing is terrible because everyone's calling in sick, that affects your patient care and you can't ignore it. Right. Because you are now no longer a staff nurse, you are a leader. And so what does that mean in terms of helping people to do some assessment in terms of their own self-care? Not only for the nurse practitioner who gets out there, but for the system that she works in.
Exactly.
And then really developing a self-care plan of some kind that might be a usable plan for people. So yeah, I mean, these kinds of, every one of these competencies lends itself to a really concrete learning experience. So there's self-assessment tools out there. So are we actually doing these with our students? Are we helping them to identify what they can do? One of the other things that I think is also really important is to make sure that people maintain their professional identity by looking at leaders in the profession. I think I teach one of my philosophies of care of teaching is to make sure that people leave my program with a sense of what I call professional literacy. Do they know what's happening in their profession? Are they members of a professional organization? Do they know who the nursing leaders are? Who are the people who are writing and editing the textbooks? What do they do? What are they leading? And to make them step back and look at the history for me and if what palliative care is and how palliative care has evolved. And the thing that's wonderful about palliative care is it's such a nursing paradigm, truly, because we think about palliative care as being truly whole person care with a multidimensional paradigm. psychosocial spiritual paradigm, which is the essence of what nurses are. And so that interconnection between us, that cross-cutting piece, is really important for us to then recognize our leaders. And I love to tell the story about Cicely Saunders. For those of you I may not be aware, Cicely Saunders is a woman who basically developed the concept of hospice care. And Cicely Saunders was originally a nurse who then became a social worker, who then became a physician. So she's like a walking interdisciplinary team, but she has a true nursing background. And so I think it's really important for nurses to recognize that we have been at the forefront of palliative care, and we've been leaders in palliative care since it began. So that's, knowing what's important in your profession, I think, is also a really important piece of what we teach our nurses, to have this professional identity so that they can lead. Any other questions? Anybody? I mean, I guess people are just tuning in to hear what's happening, but I'd love to hear if there's anybody else who has anything that they have found that has worked that they'd like to share with us. Is anybody using, in these last few minutes, is anybody using these modules? If they're not, what are they using instead? Can you supplement the module with?
And actually, as people think on that, I do have a question for you. I'm going to pick your brain. So one of our, the GA Care statements is about consulting with specialty services for complex palliative care. Now you teach in the specialty program, right? So you're teaching to some extent the students who would be consulted for those complex issues. But what are your thoughts on in this vein of APN leadership, and maybe for the different types of specialties or the different APN programs? Any thoughts on how we help those students figure out who are those patients who benefit from palliative care, right? In general, right? Who are those patients who have serious illness, but then also how to, in their new scope, figure out what is something in my scope and in my capacity versus when do I need to refer out, as opposed to everybody needs to get referral. What are your thoughts on
Right,
that?
absolutely. I mean, we spend a lot of time talking about how wonderful palliative care is, and then we have to backtrack and say, not everybody should get a palliative care referral, right? And we talk a lot about primary palliative care, and what are you doing now that's palliative care? So I have people list out, once we define it and we talk about it, then we talk about, okay, so in your practice now as a primary care nurse practitioner, assuming you're in that mindset, what palliative care are you doing now? And then what could you do better? And that's what you're going to learn from the course, right? What do you want to do better? What do you want to strengthen? But then when do you need help? Right? And that when do you need help question becomes oftentimes, when do you need expertise in symptom management that you don't have, right? And particularly people struggle. We just spent 8 hours, I do some hybrid executive stuff. So we had an 8-hour course this week on pain management. And I don't know about the rest of the country, but in New York City, primary care people don't do pain management. They don't prescribe opioids here. They send everyone to a pain management specialist, which is not very practical in the real world. But people are very fearful about that. So what kind of pain management protocols are you comfortable doing? And when do you need help? When does it get complex? When you are out of your comfort zone. I always tell students when they come out and they leave a practice, or they start a practice, I should say, wherever it is, let's say they're working in a health clinic or wherever, that they make a self-orientation, right? And so you'll give in an orientation, I hope, of some kind. Maybe you are, maybe you aren't, but and then you think to yourself, what is it that I need to find out in this practice? What are my who are my go-to people going to be when I need someone who needs therapy and doesn't have money, or I need some help with someone who's who's looking at their like they're addicted, or I need some help with complicated pain management. So I tell them to, I'm totally dating myself. I say, make yourself your own Rolodex of people you need to help. Of course, no one has a Rolodex anymore, even knows what a Rolodex is, but to be able to have that list of information and contacts of people, and when do you do it? And, I say, if you can identify a patient that has a level of complexity that you don't have the ability to address, or in reality, don't have the time to address, that's when you need to call for help. So patients who are going to have problems, bad copers, bad symptoms, difficult families, things like that, complex scenarios. And then who to help. One of the things, of course, these days is how do you find help for palliative care needs in the community? And that's often very hard to find. People call me all the time asking for help. And so I have now a Rolodex of who's doing outpatient palliative care in my community that I can make referrals for. So you get a lot of informal questions as well about that. So that's a good question. Thanks for asking that. Anybody else with any
Okay.
questions? Or comments? Yes, hi,
You're muted, Kathleen.
you're muted. Gotta find a mouse.
Oh my God, you would think this far after COVID, I would know this. So I work predominantly with pulmonologists. And so, a lot of them have this, what's termed prognostic paralysis in telling the patient that they have a serious illness and it's, most likely that they'll die from it. So consequently, they don't.
Right.
And anyway, so we're trying to, like, I gave a talk recently and I brought up this term of, instead of being afraid of it, like ask, the surprise question, ask yourself the surprise question. And it was interesting to see their response to that. Because they would be like, oh, well, yeah, there's no way this person is, going to live more than a year. But the other thing that I also really like is I like the CAPSI resources and like just giving them that resource so that they can find care wherever the patient is in whatever community. It's like those are 3 tips that just, hopefully help our patient population. And I think that's the same that could happen across the board for anyone with serious illness.
Yes, I agree. Yeah. And for those of you who don't know, CAPSI stands for the Center to Advance Palliative Care, and I see Megan put it up there. It has a depth of a wide breadth of information available. Some of it is membership or oriented, so you have to be a member or your institution, but there's a number of publicly available resources there as well. Yeah, for sure.
Well, we are coming at time,
Yep.
so we just want to say thank you to Dorothy for joining us. Thank you to y'all for joining us. Real quick, want to just share one last resource as we conclude today, and that is our ELNEC Faculty Corner. Are y'all seeing the webpage? Yep. So we do have, this is hosted on the AACN website. We have our ELNEC Faculty Corner, where we have information about the graduate competence statements and our curricular mapping resources about the online curriculum. We have a regional support model we're doing for faculty. We have teaching resources. We'd love for graduate faculty to share their resources. We right now have a lot of resources that have been shared on the undergraduate side. We'd love for y'all to share great resources you're doing with colleagues throughout the country. And also want to briefly, this last minute, share an upcoming workshop that for this inaugural workshop for faculty, we are targeting undergraduate, and then we hope that this will have a repeat and focus on graduate. But we are this summer offering a 2-day workshop focused on teaching palliative care in undergraduate programs. So, would love for you to take this back to your schools. And if you have faculty who are leading this work in your undergraduate programs, encourage them to apply. It is almost free. The only thing that is not covered is travel, but it's registration's free. We're staying in the dorms and we're covering the costs for that. And the applications are accepted till April 1st. So please share that with someone from your school, or it could be you if you teach across programs, but just want to
Ryan
make
just
sure
put the
people know
link
about
for
that.
that. Ryan put the link in the chat, and I also added the link to the faculty corner. So spread the word. And thank you so much for being here. We're gonna shift gears in the next couple of months and do sort of student-facing engagement around palliative care education
Yeah,
in our
so
future.
we'll be hearing more
Wonderful.
from students in
Thank
the
you so
coming
much.
months. So thanks,
Thank you for your
everyone.
time, Dorothy.
Thank
Thanks,
you. Nice
everyone.
chat.
Good